Hello, cherished viewers. Welcome again to Lancashire Hub channel. Today, we are going to talk about administration of medication, specifically administration of a tablet. And so sit back, relax, and enjoy the video accordingly. When an order is made for a nurse to administer medication to a patient, particularly a tablet, a mixture, or any form of medication, the first step the nurse does is to check the physician order for the medication. That is by checking the treatment sheet either on the PC, as you can see on your screen, using the drug chart to confirm if actually the order has been made. You confirm the doctor's order for that drug. Cross-check. Most people use a paperless system on the PC to be sure that the order has been made. The nurse then proceeds to set up the items for the medication administration, which includes a tray, the cup the patient will use, which is mostly by the patient bedside, a saucer, a spoon, and a disposable tissue paper or a patient's personal napkin. The nurse assembles these items on the trolley with the water that the patient will use. Most often, these water and cup are mostly by the patient's bedside. The nurse then proceeds to explain procedure to the patient. Good evening. How are you doing? You don't look very cheerful. Is there anything wrong? Yeah, okay. This afternoon the doctors came around for their review and then we came to take some sample from you. They are taken to the lab. The results are in, and then per the interpretation, you have some. Inform the patient about his or her medication that he is about to take so that to gain the patient comfort and consent as well. Remember, explanation of procedure is very key to a patient during procedure as it ensures cooperation and also patient consenting to the procedure as displayed on your screen. After performing your hand hygiene and set up the tray with the required items, after explanation of the procedure, the nurse then proceeds to perform hand hygiene as being displayed. In performing of the hand hygiene, it's important to use the World Health Organization's protocol of hand washing when we are performing our hand washing as health professionals or as nurses. The nurse then proceeds and pick the tray that the nurse has set or he or she has set to the patient's bedside. We must also remember to observe the 5 rights of medication administration, which is the right patient, the right time, the right dose, the right to know and consent or to refuse, and the right medication. These rights are very, very important in medication administration. When you arrive at the patient bedside, inform the patient that you are back to continue with the procedure as discussed. You provide privacy during medication administration. Providing privacy helps to respect the dignity of the patient and also promotes confidentiality in care. The nurse then picks up the treatment sheet and the medication and observes the rights of medication administration. With the right patient, right medication, the right time, right dose, and ensure patient consent to has been displayed on the screen. So you are going to take it, or you swallow the medication for me. So are you okay with that? You have to take it around 3 p.m. and it is 30 minutes past 3, so it's still within the time. Okay. You have the right to refuse medication, but I will urge you to make it right and resolve your infection so that you can go home. And so, with your permission, can I go ahead and administer it? Observation of the rights of medication administration is very crucial in medication administration. After observing the right, the nurse then helps patients assume a comfortable position, either by sitting up or you can use the rollers on the bed to help position the patient in bed. If the patient is able to move, the patient can equally sit at the edge of the bed, any comfortable position the patient wants to adopt. If the patient is comfortable in that position, the nurse then proceeds to remove the pack, check the label on the pack and compare to the treatment sheet as being displayed. It is important to observe this because sometimes wrong medications can be inside a wrong pack. Therefore, the need for this check. The nurse then removes the drugs into the spoon on a saucer and place the drug back into the package. After doing that, the nurse then makes sure he secures or protects the patient's upper portion with the disposable tissue or towel, pours out the water, and asks the patient which one he or she wants to take first. If the patient so desires to drink the water first, you administer the water. If he or she wants to take the medication first, you give the medication to the patient. Take water first or run the tablet first. The last check is done before the medication is administered. The medication is picked in a spoon with a saucer to the patient. If a patient can take the medication by him or herself, it's done. Or if there's weakness of the limbs, the nurse can assist the patient with the medication. Drinks the water. The nurse then congratulates the patient and finds out if the patient has actually swallowed the medication. This is done by engaging the patient in a brief conversation. For instance, have you seen your wife around today? This will cause the patient to speak so that the nurse can be sure that the medication was swallowed. So I'll make sure she brings the food. Mr. Pastor, with this medication, sometimes you can feel a slight headache. It's a normal side effect of the medication. So for now, I encourage you to be in bed for the next 10 minutes. I'll be observing you. But then anytime you feel itchiness or rash around your skin and difficulty in breathing, you can quickly bring the call that will come and attend to you. However, I'll be checking on you intermittently from time to time. Remove your screen. Make patient comfortable in bed. You pick your trolley and discard any used items. Wash your hands and document the procedure in your respective nurse's notes and treatment sheets. This comes to the end of this short video on how to administer tablet. Thank you.